Here's my note card that I'm using. Go ahead and put that here. All right. Knock, knock, knock. Performing hand hygiene. Hi, my name is Elizabeth Thomas. I'm going to be your nurse for today. Would you please be able to state your full name and your date of birth? Emily Johnson, 0503-1995. Awesome. Thank you so much. And Ms. Johnson, do you have any known allergies that you're aware of? No known allergies? Okay. And do you know where you are today? Yes, you're in the hospital. Do you know who the president is today? Yes, Mr. Biden. And do you know what day is today? Yes, it is Friday. Very good. And can I ask how are you doing today in overall, your general mood and well-being? You're doing great. That's awesome. All right. So I just spoke to the CNA, and he informed me that all your vital signs were complete. You're not experiencing any pain today. Your temperature, your pulse ox, and your respirations were all within the normal range. He also explained that he performed the Snellen eye chart test, which tests for distant vision, which tests for cranial nerve number 2. And he said that you have 20/20 vision, which is a good normal finding, means you can see at 20 feet what a normal person should be able to see at 20 feet. So cranial nerve number 2 is intact. So if you don't have any other further questions, we're just going to go ahead and begin our head to toe. So we're going to start with the head, and I'm going to assess the head. I'm going to see for any abnormal color. Color is consistent with skin color. I don't see any lesions or any scarring. I'm going to palpate just the head, inspect for any abnormalities, any tenderness, no tenderness. I'm assessing the hair. Everything looks good. The patient feels like a normal temperature, no excessive heat, normal skin warmth, and no edema as well. All right, so now I'm going to go ahead and I'm going to assess the ears. So I will take my otoscope. For an adult client, I would take and pull the pinna back and up. This tympanic membrane is pearly gray. There's no perforations and no wax buildup. Same thing on the other side. Tympanic membrane is pearly gray, no wax buildup, no perforations. Everything looks good. Now let's go ahead and take a look at those nares. Inspecting the nose, there's no excess mucus production. The nares look moist, no signs of dehydration, and no dryness. Now, would you open your mouth for me? Very good. I don't see any dental abnormalities, no gingival hyperplasia. The patient doesn't seem to have any signs of dehydration in the mouth. Everything looks nice and moist. All right. Now that we're finished with the head, let's go ahead and move on to your neck. So now I'm going to palpate for your neck, and I'm assessing for anything that feels enlarged. Everything feels good. So what I'm going to do is I'm going to palpate for your trachea. I can feel the C rings, and your trachea seems to be midline, which is a normal finding. Now I'm going to assess and palpate for your thyroid. To do this, I would be standing in front of the patient. I would displace with my left thumb, and I would palpate the thyroid with my right thumb. No enlargements, everything seems normal. Same thing on the other side, I would flip. I would displace with my right thumb, and I'd palpate the thyroid with my left thumb. I don't feel any enlargements, which is a normal finding. All right, so now let's go ahead and let's palpate for the lymph nodes. To do this, I would be demonstrating on myself. I can palpate for the lymph nodes for the submental lymph node, for the submandibular lymph nodes, for the preauricular lymph nodes, for the parotid lymph nodes, for the occipital lymph nodes back here. I can feel for the supraclavicular here. I can feel for the interior cervical lymph nodes here, posterior cervical lymph nodes here. All the lymph nodes feel normal. No enlargement of any of the lymph nodes. They're not hard. They're not immovable. All the lymph nodes feel good. All right, now let's go ahead and assess for JVD. And what I'm looking for is jugular vein distension. The patient is in upright position, and I cannot see any of their jugular veins, which is a normal finding for a patient in this position. Now let's go ahead and palpate for the carotid pulses one at a time. On the left side, carotid pulse feels good and strong. On the right side, carotid pulse feels good and strong. Now let's go ahead and auscultate the carotid pulse and listen for any bruise with the bell of my stethoscope. I'm not able to hear any bruise, which is a good normal finding. Now let's go ahead and palpate the carotid pulse and compare it to the apical pulse, which is that I would palpate and feel for the fifth intercostal space, left midclavicular line. All right, on the right side, carotid pulse is equal to the apical pulse. Let's do the left side. parotid pulse is equal to the apical pulse, which is a good and normal finding. All right, so now let's go ahead and let's test for your cranial nerves. So I'm going to ask you to close your eyes and ask you to say what you smell. Very good. That is perfume. So very good. So cranial nerve number 1, the olfactory nerve, is intact. We said before the cranial nerve number 2 is already good. You have 20/20 vision. Now let's test for cranial nerve number 3. So I'm going to test for perla. So I'm going to shine my pen light in both eyes. Pupils are equal, round, reactive to light. Now would you be able to follow my pen light with your eyes? Very good. The eyes are able to accommodate to my pen light, which is good, normal finding. Cranial number 3 is intact. Now let's test for cranial number 3, 4, and 6 by doing the 6 cardinal fields of gaze test. Would you be able to follow my pen light and just move your eyes, not your head? Good, 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 good. Very good. So the cranial nerves number 3, 4, and 6 are all intact. I don't see any signs of nystagmus or any jerking, which is no jerking of the eye movement, which is good. A normal finding. Now let's go ahead and test cranial nerve number 5 and 7, the trigeminal nerve. To do this, I will take my cotton wisp, and I'm going to ask you to close your eyes and tell me when you feel the cotton wisp that I'm putting on your face. Very good. Very good. The patient is sensitive to touch on their face, which is evidence of the trigeminal nerve being intact. I'm going to feel for your TMJ joint. I would place my fingers anterior to the tragus, ask you to open and close your mouth. Very good. I don't feel any displacement. The TMJ joint is intact and working properly. Now, would you be able to smile for me? Good. Frown for me? Good. Raise your eyebrows? Good. Puff your cheeks? Very good. The patient's facial nerve is intact and good. Now let's go ahead and test for the cranial nerve number 8, the vestibular cochlear nerve. I would ask the patient to stand up and I would perform the Romberg test. To do that, I would have the patient stand up, put their arms at their side, and ask them to stand still for about 20 seconds, and I would watch for any swaying, any movements. The patient is able to do this without any swaying. Their equilibrium is intact. Now I would perform the whisper test to go along with that cranial nerve. I'm going to whisper something to you and repeat back to me whenever you hear what I'm saying. 1, 2, 3. Patient is able to say 1, 2, 3. ABC. Patient is able to say ABC. I would have whispered more in the first test. The patient is able to perform the whisper test correctly, so that means cranial nerve number 8 is intact. Now I'm going to test for cranial nerves number 9, 10, and 12, which is the glossopharyngeal nerve, the vagus nerve, and the hypoglossal nerve. To do that, I would ask the patient to open their mouth, take my tongue depressor, scratch on the back of their throat. Their gag reflex is intact. I would ask them to take a sip of water. Very good. They're able to swallow without any problems. And I would ask you to please stick out your tongue. Please move it side to side. Very good. Their hypoglossal nerve is intact. Now I'm going to ask you to please shrug your shoulders against my hands. They're able to do this without any issues. Cranial nerve number 11, spinal accessory nerve, is intact. Great. So now all the cranial nerves have been assessed. Everything seems to be intact. So now what I'm going to do is I'm going to assess for your gait and your balance. I would ask the patient to stand up, walk across the room, walk back across the room, and assess for any balance issues, any wobbling or swaying. The patient is able to do this fine. Their gait and their balance are normal. Now I would test for upper and lower cerebellar motor reflexes. Would you please be able to repeat these, follow these, my hands, and do the same thing as me? The patient is able to do this without any issues. Would you please be able to lift your right leg, the right heel of your leg to your left shin? Very good. The patient is able to do this. Do that on the same side again. The patient is able to move their left leg to their right shin, their left heel to the right shin without any problems. That is intact. All right, very good. Now let's go ahead and move to your chest and your arms. I'm going to go ahead and just assess your chest area. I'm going to see for any scars, any lesions. There's nothing like that. The color is normal with skin tone. I'm going to assess for trigger by gently pinching the skin and seeing the recoil. Everything looks good. No signs of dehydration. Now I'm going to inspect the thoracic cavity. I'm going to see for any abnormalities, any distension. I don't see anything like that. The thoracic cage looks good. The muscle, or the way the muscles are together, they look good. There's nothing abnormal there. So now I'm going to go ahead and I'm going to assess your reflexes. So I'm going to go ahead and take my my tool, and I'm going to assess for your tricep reflex. So for that, I would be tapping the patient right about here and assessing for jerking movements. For slight jerk, which is normal finding. The tricep reflex is intact. I would assess for the brachial reflex. So I would tap it right about here and do that on both sides. Reflex is intact on both sides. Then I would assess for the brachioradialis reflex. I would assess here in this area. There's a slight jerk, slight jerk, slight jerk. All the reflexes, the tricep, the bicep, the brachioradialis reflexes are all intact. Now I'm going to go ahead and feel for the radial pulse and the brachioradialis pulse. The brachial pulse feels good and strong on the right side, good and strong on the left side. Be feeling it right about here. Now I'm feeling for the brachial pulse. Be feeling right about here. Feeling good and strong on the right side. Good and strong on the left side. And I would compare the two. Feel the radial pulse, feel the brachial pulse. Feeling them at the same time, they are equal. Feeling them at the same time, they are equal. Very good. Now let's go ahead and test your strength. So would you be able to push against my hands? Very good. Strength is 5 out of 5 on both sides, bilaterally. Good strength. Now would you be able to lift your hands for me? Put it down. Lift your other hand for me. Put it down. Range of motion is good on both sides, bilaterally for the right and the left arm. Very good. Now I'm going to go ahead and assess for capillary refill. I'm going to press on the nail beds of the fingers of the upper extremities. Capillary refill is less than 2 seconds on both sides, normal finding. All right, now let's go ahead and move on to listening to the heart and the lung sounds. Let's start with the heart sounds. I'm going to palpate and I'm going to feel for the right sternal border, second intercostal space to find the aortic area. Listening. S2 is greater than S1. Palpating for the left sternal border, the second intercostal space for the pulmonary area. S2 is greater than S1. Palpating for Erb's point, which is the left sternal border, third intercostal space. Listening with my stethoscope. S1 and S2 are equal here. Palpating for the tricuspid area, left sternal border, fourth intercostal space. Listening here. S1 is greater than S2. Now I'm feeling for the mitral area, the apical pulse for the mitral area, and I would feel for the fifth intercostal space, the left midclavicular line. Listening, S1 is greater than S2. So the heart sounds sound very good. And I'm going to go ahead and listen for the anterior lung sounds. I would listen in 8 spots bilaterally, going back and forth. Take a deep breath for me. Good. 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 Very good. Very good. Very good. Very good. So lung sounds are clear. I don't hear any abnormal breath sounds, no crackles, no wheezes, don't hear for any shortness of breath or gasping of air. I'm going to do the same on the posterior side. I would listen for 8 sounds bilaterally, asking the patient to take a deep breath in each time. Take a deep breath in for me. Very good. 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 Posterior lung sounds are normal and equal. I'm going to listen for the lateral lung sounds. I'll listen about 3 areas on the lateral side. My stethoscope. Very good. Very good. Very good. Lung sounds, anterior, posterior, lateral, are all clear. No signs of crackles, wheezing, fluid in the lungs. Everything sounds good. All right, and as well, I was going to go ahead and palpate for thoracic symmetry of the respirations. I would place my hand like this, feel as I take a deep breath in. My hands move symmetrically. There's no unilateral movement of the lungs, which is a good normal finding. Do the same thing on the posterior side. Feel as they breathe in. My hands move symmetrically. There's no unilateral movement. Everything is bilateral and equal. Very good. Their breath sounds have a normal pattern. They're unlabored, and they're equal, and they're even. So everything is good in their respiratory system. All right, so now let's go ahead and move on to the abdomen area. I'm going to ask you a couple questions about your GI and GU system. Let's talk about your last time you had a urination. So you went to go urinate 30 minutes ago. What color was it? About a paleo. Did you smell any funny odor? No abnormal odor. When's the last time you had a bowel movement? This morning. What color was it? Brown. Did you have any, did you know if it was more formed or if it was more watery? It was a regular form consistency. The bowels and the urination were both normal, no abnormalities there. Let's go ahead and take a look at your abdomen. I'm assessing for any ascites, no signs of ascites, no edema, no redness, no scars, no lesions. Everything looks good. Inspecting the abdomen and assessing that area. Now let's go ahead and auscultate, and we'll take a listen to your bowel sounds. Let's start in the right lower quadrant. Listen for a full minute. Right upper quadrant, left upper quadrant, left lower quadrant. Bowel sounds are normal. Don't hear any hyperactive bowel sounds. I don't hear hypoactive bowel sounds. Bowel sounds are high-pitched gurgling, which is a normal sign. Now let's go ahead and percuss your abdomen, starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. No abnormalities there. Now let's go ahead and palpate with light palpation. Just let me know if you feel any tenderness. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. All right, the patient does not feel any tenderness. I don't feel any distension or any enlarged organs in the abdomen, which is a good normal finding. All right, now let's move on to your lower extremities. Let's just assessing for any edema, any lesions, any scarring, nothing like that. Everything looks good. Skin color is consistent with the patient, with the rest of the body. Everything is normal. Now let's go ahead and test the strength on both sides. Push against my hands. Strength is 5 out of 5, equal, bilateral. Strength is good on both sides of the lower extremities. Now would you be able to lift your leg up for me? Lift your other leg up for me. Move it to the side. Move your other leg to the side. And move it inward. Move your leg inward. Range of motion on the lower extremities is good. Equal, bilateral. All right, now I'm going to go ahead and test for your patellar reflex. Should be on the knee here. Patellar reflex is equal on both sides. All right, and now I'm going to feel for the pulses. I would feel for the dorsal pedal pulse, which is beyond the dorsal side of the foot. Top side, very good. Now I'd feel for the posterior tibialis pulse, which is posterior side of the tibia here. Feels good. They're equal on both sides. Strong. Very good. Now I'm going to test for your capillary refill. Pressing on the toenails of the patient on both sides. Capillary refill is less than 2 seconds on both sides. This concludes our full head-to-toe assessment on this patient. Thank you very much.